Hi, I'm Virginia. I've been a medical writer and content creator since 2020 and a UK registered pharmacist since 2014. So in this video, I want to answer the question, can you be a medical student studying to be a doctor at university and also learn medical writing as a source of income on the side? So I've had many different versions of this question in the past, and my answer to this is when you are a medical student, there's a lot to learn, and you are learning how to look after other humans and also look after them when their health is not in a good state. So you are going to be learning how to diagnose people, suggest a treatment, then follow up on that treatment, and so on. So that's already a lot of work for you. So if you want to learn the skill of medical writing, that would be helpful. And in the small amount of spare time that you have as a medical student, you could invest in learning the skill of medical writing. And that would actually be beneficial for you because as a doctor, you will be communicating with patients. And usually when you are studying, you're learning lots of complex terms and language and information. And you're going to have to understand how to actually kind of translate that technical language into something which is easier to understand for your patients. So if you do learn medical writing and improve your communication skills, that can make you a better doctor. And so I would recommend that you focus on your studies as a medical student, probably until your very final year. Then you might have the confidence and maybe some breathing room to actually start learning the skill of medical writing or anything else you want to learn. So keep your options open. And I would also say that you can start writing about anything. So you don't need to write medical things to become a medical writer. Just start practicing how to structure information. And that puts less pressure on you. So if you are a medical student and you want to earn income on the side, there are lots of things you can do which are less challenging to get into. I would actually recommend a service job. So maybe working in a coffee shop, because when you do the job, it's there in the moment and you don't have to take anything home with you. Now, I understand that medical writing is a job that you can do while you're at home. So you don't need to go outside, you don't need to travel for work. But it is much more competitive because everybody wants that kind of lifestyle job where you can fit the work around what you're doing. And also you do get a lot of screen time when you are a medical student because you're constantly reading things, maybe looking at pictures or maybe 3D simulations, or you're watching videos about things. So if you then do medical writing on top of that, you are going to have even more screen time. So just consider that. And medical writing, you can earn a good income probably when you're in your later years of your medical degrees. So when I was working in a medical communications agency, I did have a student at medical school in Cambridge, and she actually had about 5 hours every week where she was helping us write some blogs, and I would give her feedback and she would improve it, and then she would build up her medical writing skills that way. And when she graduated from medical school, she actually ended up doing part-time clinical work and part-time medical writing work because she had built up her portfolio in her final year of medical school so that she could then have something to show to prospective clients. And she was also a qualified doctor as well and practicing clinically. So she didn't have 5 days a week of clinic time face to face with patients. So she's actually now moved into public health, and she invited me to do a public health talk to some people in the NHS in the UK, which was very cool. And I was able to do that virtually. And it's nice to know that you can build those relationships when you are a medical student. You also have to be quite receptive to feedback. So I understand that it's quite difficult to get into medical school. When you're there, it is a privileged position, but you do need to be of the mindset that you are developing skills and you are a perpetual learner. So you're going to be learning essentially for the rest of your life. And whatever you learn today might not necessarily apply tomorrow because guidelines and evidence bases change all the time. And this is what makes health and medical writing and even practicing medicine quite unique. So yes, you can learn medical writing. I would recommend during the later years of your medical degree. And I would say focus on your medical degree first because it's an investment. Your time and energy and money should go into you becoming a doctor because that's what your medical degree is for. If you feel like your medical degree is something that you no longer want to do, then you can switch to a different science degree, and you can also then decide if you want to pursue medical writing. There is no clear straight path into medical writing, so I would say consider that as well. So if you do become a medical doctor, you can go into medical writing or you can go into something else. So some people might go into reviewing documents or fact checking them, because I would say that with AI right now, if you are a skilled writer, you can train AI to write, but it will still need to be fact checked as well. So looking at the evidence, making sure that there are no hallucinations, and then also that the information is accessible to the audience that you're writing it for. So are you writing it for patients? Are you writing it for other healthcare professionals? Or are you writing it for a sales team? So those are things that you will want to consider as well. If you do want to kind of get started, then there is a free medical writing skills for beginners video course, which I will link to in the video description below. And you can take that and you can also get a free certificate. And I hope that you really enjoyed watching this video. Thank you so much for watching, and I'll see you in the next one. Bye.